Doctor, I have suffered from adverse mental health issues since I was a child. I was born with ADHD. I didn't know about it. That undiagnosed, untreated ADHD led to numerous other problems in life. I suffered a few episodes of depression, complex PTSD, anxiety disorder, and I think my lowest was when I also developed fibromyalgia and chronic fatigue syndrome. I was in a lot of pain and I was quite desperate. I was trying out numerous different technologies to try and get relief. So I would try something, it wouldn't work. I would try something, it would work for a little bit and then not work at all. So I was looking for something which would help me. That was the initial reason for looking into TMS. The second reason for choosing TMS was I was quite fed up of the spray and pray approach of doctors. I mean, now I understand that the brain is an electrochemical organ. And in my experience, my doctors were just giving me the chemical, which is, here's a pill, try it. So they would give me one pill, I would take it for a while. Then because of that medicine, there would be some adverse effect. To counter that adverse effect, they would give me another medicine. That medicine would create some adverse effect. To counter that, they would give me another medicine. And before I knew it, I was on 6, 8, 9 psychiatric drugs. And they were not working. I also didn't know what was wrong where. It was imprecise, it was not targeted, it felt like guesswork, and I was looking for a treatment which had better foundations in modern day science. And that is when I came across interviews of Tim Ferriss, who speaks about the TMS technology. I found out that this is a very effective protocol. It's very new. The Saints protocol is very new. And then I started looking into different places where I could get this treatment done. Yeah, that is how I came to TMS.
Were you not completely satisfied with traditional medication?
Absolutely not. I wasn't. It's been said before, insanity lies in doing the same thing over and over again and expecting a different result. For years, it was the same SSRI, it was the same benzodiazepam to bring down your anxiety, and they weren't really taking the problem away. So I didn't want to be in a state where I spend the rest of my life just constantly popping pills just to try and keep some of the symptoms under control. Because it was very clear to me that the underlying issues were not being dealt with. The symptoms were getting masked through these medicines. The underlying problem was just not going away. I mean, what it felt to me like is, if I have an infection and I develop a fever, if the doctors just keep giving me paracetamol, the fever will go away, but the underlying infection won't. Similarly, I wasn't very clear what the underlying problem was, and it didn't make sense to me that keep on taking medicines just to deal with some of your symptoms. So I was not satisfied with the traditional approach of just giving chemicals, because sometimes those chemicals work and sometimes those chemicals create a very adverse effect. And I had experienced both of them. So I was looking for a treatment option based on latest medical science, where the doctor could examine the organ and say precisely what is wrong where. I mean, that is done for the rest of the human body. It was just not being done for the brain. So when I came to your clinic and I realized that first an EEG is done where you figure out what is wrong, and based on years of experience that you have in dealing with hundreds of patients, you were able to tell me which part of my brain would get targeted, what kind of treatment would take place. And you didn't say it to me in a chest thumping way. I mean, it was quite conservative. You told me that, look, sometimes it works 70%, sometimes it works 100% for others. So you gave me the options, and I took the call to go with the treatment.
So what made you to decide to come to Poland? After all, TMS has originated in UK and it's widely available there.
Actually, a very important consideration for any patient is the cost of the treatment.
So what's the cost differential between UK and Warsaw?
When I found out about TMS, I started making phone calls. I made phone calls to the United States. I spoke to several clinics out there. I spoke to several clinics in the United Kingdom. And I realized that though the treatment was available, it was prohibitively expensive. You know, you're looking at 25,000 to 40,000 pounds sterling for the entire treatment cost. And that just wasn't an option for me. When I got in touch with Magwise and when I found out about the pricing, I was a bit skeptical. I was like, it's so cheap. I wonder if the technology is just as good. I'll be honest with you, that was one of my concerns.
So does it represent value for money?
Oh, absolutely, because now I know, see, the proof of the pudding lies in the eating. I've been through the treatment, I have received the benefit. First, I no longer have my fibromyalgia pain. It's gone. I no longer suffer from the chronic fatigue. It's gone. I have some issues that, we are still working on. For 20 years, I did not derive any pleasure from listening to music. When I started this treatment, I also started learning how to sing. Yeah, I did, because this treatment also leads to heightened neuroplasticity. So I thought, okay, let me use this to learn something. And doctor, you won't believe it, but at the age of 52, I'm finally singing now. I'm getting a lot of pleasure from music. So first, the treatment worked. Second, it's made a huge difference to the quality of my life. That was my biggest problem. I was alive, I was living, but my quality of life was very poor. It has increased my quality of life. And having now worked not just with you, but numerous members of your team, I am aware that the technology that is being used is the very latest. There are neuroscientists that are working on these EEGs. So the technology is good, the knowledge is there, and you combine the two to providing the treatment at a very reasonable price. That works for me.
Okay, Ori, did you experience any discomfort in the process of or as a result of TMS treatment?
Not really. I was scared. I was scared because of my own fears. Someone's going to place a magnet on your head and the magnet will do ta-ta-ta-ta-ta-ta-ta. I was a bit scared of that. But after doing it the first time, I was like, okay, this is no pain whatsoever. And it was quite pleasant. You lie down on the chair, the treatment goes on for 7 minutes, 10 minutes, 20 minutes, whatever. So initially I had some fear, but there was no discomfort through the treatment. There was one instance where during the treatment, didn't feel good, and doctor, you are aware of it. There were some medicines that I was taking at that point of time, And you immediately got in touch with the resident neuroscientist. The neuroscientists immediately looked at the EEG. I remember over the weekend, the neuroscientists worked on it so that when I was back in the clinic on Monday morning, you knew very clearly what had gone wrong and how that was going to be addressed.
We needed to alter your medication in order to continue TMS therapy. This is what happened.
And that is very precious to me, because you'll remember my experience with traditional psychiatrists has been give him this medicine, let that medicine go on for 6 weeks, 12 weeks, and then come back and report to me. What happens to all the suffering in those 6 to 12 weeks? In this instance, I felt something on a Friday. The neuroscientist looked at it over the weekend. Monday morning when I was back in the clinic, we were very clear what had gone wrong and what changes needed to be made.
Tell me, at which point of time you were able to feel positive results of TMS? And how significant were they?
Well, you know, when I was doing the Saints protocol, it's I was staying in an apartment not very far from your clinic. So I did the treatment through the day, and I remember when I was walking back from the clinic to my hotel room, I was singing, and that doesn't happen. I noticed I was singing because as I was walking down the street, people were turning around and looking at me thinking, what's wrong with this guy? You know, he's singing. So that's when I noticed for the first time that something had shifted in me. That night, I slept really well, and this was the first time in a very long time that I had slept a full night of sleep. But I think the magic started happening about 3, 4, 5 weeks after the treatment. So the fibromyalgia pain which I was feeling, it didn't go away immediately. It's not like a light switch that it switches off. I discovered that it's a slow process. The treatment sparks neurogenesis, which leads to neuroplasticity, and then you start feeling some of the benefits of the treatment. So for me, I started feeling the benefits about 4-6 weeks after the treatment.
How sustainable and consistent were these effects, and did they show a tendency to fade off or fluctuate?
For me,
yes.
No. It's been consistent. It hasn't faded. It's the effects of it, the benefit of it, I still feel. I'm going to give you 2-3 examples. One, when I started feeling better, I started singing. And I remember then I was a bit concerned that, is this just temporary or will it go away? My singing teacher just informed me that I've finished 50 classes with my singing teacher. And this is the first time in my life I'm learning singing. So it's clear, the number 50 classes tells me that over this period of time, this faculty which had gone away and came back to me is still there with me. Second example, fibromyalgia pain. I used to have a searing pain, you'll remember, along the sciatic. That pain hasn't come back. Like, it took some time to go away, to fade out, but when it left, it has never come back.
And from the neuropathic pain, we did just a few sessions. It was
just a few sessions.
I think it was 10 sessions.
That's it. Yeah.
And it literally gone for after a few days.
It's gone. Yeah.
Mm-hmm. Ori, what would you say to anyone suffering for similar afflictions, who perhaps haven't explored possibility and benefits of undergoing TMS therapy at Magwise?
Doctor, you know only too well the pain that someone suffering from mental health condition goes through. The pain, the shame, the frustration of trying out so many different things and them not working. I would say TMS, which is the latest that I know of in brain sciences and is backed by neuroscientists and technically very qualified people, I would encourage them to try it. Now, will they have fears? Possibly. I had fears. My first fear was, oh my God, I have to travel to Warsaw. Actually, after doing the first trip, it's just fine. It takes me 2 hours on the plane. From the airport to my hotel room, it's a 20-minute taxi ride. I'm familiar with the staff out here. I finish my treatment, I go back home. So now it feels a lot easier. But I remember the first time it didn't. So yes, there will be that. The treatment is not painful at all. It's literally placing of a magnet on your head. So I would say, if other things haven't worked for you, and if you want a more precise answer to your mental health issues, this is a good technology to try. And it's not expensive here. It's very expensive in the United States. It's very expensive in the United Kingdom. For me, in my personal circumstances, this is not as expensive, and I am willing to spend this money to get my quality of life back. It does not make sense to go and spend loads of money buying an expensive bag or an expensive car if my own quality of life is very poor. But this money that I have spent has actually improved my quality of life. So for me, it's money well spent, and it's a reliable, sustainable, and a durable treatment for me.
Learn more about TMS therapy. Visit magwise.org and schedule a consultation.